Hi, welcome everyone to this week's Med Talk. This is going to be recapping Diversity Week and just a couple of housekeeping items. Any Q&As, you can post them on the academic resources discussion board and someone will follow up with you there. Just an overview of this session is we're going to just recap the structure of the week, and then we're going to have a reflection from the student leaders, or some of the student leaders who put this week together. They're joined with us today, and then we're going to have a administrative follow-up from Dr. Rajasekaran. And so as you can see, we had 9 total events from Monday, October 5th to Friday, October 9th. And some of the topics covered were racism in medicine, racism as a form of trauma, followed by a dialogue circle. Then we had some talks on identity and intersectionality. And then we had medical education and discrimination, healthcare and vulnerable communities, COVID-19 and racism. And we also had allyship for our peers and patients panel. And we concluded the week with how to be a better ally. So we had 1,527 total participants throughout the week, and we averaged about 170 participants a session. And with that, I'm going to turn it over to the 2 student leaders we have on our call.
Hi, everyone. My name is Sarah. I am an M2 and the executive coordinator for the learning communities. And Capricia, if you wanted to take a minute and just say hi.
Yep. Hi, everyone. My name's Capricia, and I'm co-president for the Black Medical Association.
And Capricia and I were the 2 of the students that helped put together, plan, and organize the Diversity Week. And we just wanted to give everyone a little bit of insight as to why we started this initiative and where we hope to go from here. So the purpose of the Diversity Week was to shed light on some of the issues faced by members of our medical community, especially as students that are getting our education and learning and practicing in Detroit. We felt it was very important to give the whole comprehensive view, not just the medical perspective. And so as medical students, we know that the majority of us come from different backgrounds, and we might not all have the same level of understanding or knowledge about people or individuals or patients that are from different backgrounds or experiences than us. And we definitely recognize that there's a gap in our medical education as far as covering racism. And we wanted to provide a space for experienced and educated speakers to share their knowledge with us. And we wanted participants to have an understanding of how discrimination overall, and especially racism, has negative effects on individuals and community health.
So with our intention, we wanted to provide, as Sarah said, a very base level introduction to topics. We didn't think it was appropriate to go in depth on some of these topics because we recognize that a lot of students do come from different backgrounds and may not have the same understanding. So we just wanted to provide a very base level introduction from experienced and educated speakers that are part of our medical community. And we wanted to use this week to foster an inclusive justice environment within the School of Medicine, as we wanted to encourage participants to make positive impacts moving forward. And we wanted to encourage the School of Medicine administration to make the necessary changes in our medical education that represents the Wayne State School of Medicine Statement of Urban Excellence.
So as we were reflecting on our own personal experiences with this week, these were just some of the emotions that I personally felt. And I know every student felt differently and had different, depending on what kind of experience you had or how much knowledge you had coming to it. I definitely felt very emotional hearing and learning more about the history of racism in Detroit, as well as on the national scale. It was overwhelming for me at times. I felt anxious at times. I know sometimes we've tried our best to create a safe space, but the chats, sometimes I think people were so passionate trying to explain or understand, and maybe that caused some anxiety to me, and I'm sure other members that were also a part of this event. But I also felt very connected with my peers, and I felt like very proud to know that there were so many of my colleagues present at these voluntary events to learn more and to see what we can do for our patient population. And I felt very connected with the task force that helped plan this. And I felt very hopeful at the end that we could actually institute some longitudinal change to ensure that every student will have this type of education and knowledge to take with them moving forward as they begin practicing. And I don't know, Capricia, if you wanted to take a minute and talk about your reflections as well.
Yep. So my reflections were similar, and I think also reflecting and kind of also in the planning process, I think a big aspect was how do we provide this education without doing harm to the students or the communities that are already marginalized and made vulnerable. And so I think something that we can reflect on and move forward and hopefully do better next year, for the others that put this together next year, is taking that into consideration of how do we keep in mind the students that, you know, share the emotion that the emotion of having the effects of racism throughout their life, and how do we, you know, provide this education to students that don't have that experience.
So where do we go from here? We had Diversity Week, and there were a lot of really amazing discussions that came out of it and a lot of great events. But as far as a task force, and I think our peers can all agree, 1 week is not enough. And so where do we go? Our biggest plan is, and our goal is to get this integrated into our curriculum. And there is, after we finish this slide, there's a slide speaking directly to how the students are making moves to work with the administration to make that happen. But what we want is, we don't want a rushed curricular integration. We want it to be planned and intentional and thoughtful in discussing racism in medical education and medical practice. I know for the M1s, you discussed some of the Diversity Week in your P4 session last week, and I think that's a great start. But we also definitely, to echo what Capricia said, we don't want to cause any harm to any of our students. And we really want these initiatives and this integration to be as beneficial and as action-oriented and accurate and informational as we can make it. We also are looking forward to follow-up sessions. It doesn't just end with Diversity Week. We want them to be planned by students and administration alike. So we hope to keep the conversation going outside of the week and in the School of Medicine environment. We are really advocating for microaggression training, starting in the preclinical and clinical curriculums, but also for our faculty and administration as well. We recognize that everyone can benefit from this type of training. We want more safe spaces, and we want to specifically explain and define what a safe space is and have those boundaries set up so that students feel safe learning and feel safe speaking on their experiences and feel like it's a welcoming, nurturing, encouraging environment to have these very difficult conversations that I know can cause so much distress and anxiety to our peers. And we want more support for minority students. We're in a diverse city, we're in Detroit, and our peers come from different backgrounds and different areas, and we definitely need to have more built-in structure to support the unique obstacles and challenges and feelings that our minority students experience. And of course, I know that you probably all already are registered and have, if you haven't already, are planning to vote, but voting is a major action item that we can all do to create change as well. So Capricia, did you want to take this slide?
You can go ahead.
Okay, so we have, as students, created a social justice and medical education coalition. So what this coalition is, it's comprised of student organizations, some of whom were involved in the planning of the Diversity Week and Racism in Medicine Summit. So IJI is on the coalition, BMA, where Capricia is representing here today, LGBT people in medicine, the learning communities, the Latino Medical Student Association, and so many more organizations are at this table, this coalition together. And this was specifically formed by students with an aim at integrating diversity and racism education into the curriculum longitudinally. And we meet weekly. Our goal is to hopefully have that Wayne State's School of Medicine Administration recognize the coalition and leverage our experience and our input to help have a voice in how we are integrating this curriculum. I know as students, we have the most information and the most experience with this curriculum as we're the ones receiving it. And I think we can really identify areas for improvement or opportunities to integrate the education that it's so clear that the student body wants and needs, which I think is an amazing effort and something that we're looking forward to doing. Capricia, did you want to add anything to this?
Yep. And so we do recognize also that this is student formed and student-led organization, but we want the School of Medicine administration to realize that we are full-time students and we don't always have the energy or the time in our schedule to plan such events such as Diversity Week or the microaggression session. And so we really want to charge the administration to kind of take this lead to implement these aspects into the curriculum.
And then this is just the slide, and the next slide are just some really quick directions for how to vote, how to register, how can you make sure you're registering. I know we all know the election is November 3rd, and it's not the end all be all. There's so much work to do beyond just electing officials. We need to hold them accountable. We need to look for people in our lives and in our schools and in our community that are upholding the values and the individuals that we are electing. Tapinder, you can go to the next slide. And we also need to make sure that we are doing more than just voting in this one election and saying we've done all we can do. And that really does start at the School of Medicine with us. And I know that we're all working together for the same end goal, but it doesn't have to, we don't have to compartmentalize them. If you're a student who's involved in an organization or you're applying to different things right now, you could take these conversations and the things that you've learned from Diversity Week and have sessions yourself, reach out to the task force and see how you can do. Maybe if you want, if you attended the healthcare and vulnerable community session, there was some information there that you really learned that you thought was helpful for the clinic that you're running, for example, or that you volunteer at, reach out to us and let us know, and we can maybe provide you with this contact information for the speakers or some resources that you can turn to that might help you in your clinic and your organization going forward. But we all really need to take a very intentional and action-oriented position ourselves to make this change happen. And as Capricia said, we also want to be cognizant that we are, at the end of the day, students, and we can only have so much bandwidth. So I think doing our part and hopefully administration doing their part and working together, we can really come up with something that's answers the questions and the needs that the school and students have as far as who is the Detroit population, how can we be better physicians, how to get better racist, like anti-racism training, and why is racism actually detrimental to our patients.
Thank you so much to our two student leaders on the talk. And with that, we'll go to our next segment with administrative follow-up from Dr. Roger Sakaran.
Hey, thank you, Sarah, and thank you, Capricia. I'm really proud to be working with such a student body who's so committed to our mission and to doing what is right always, even though it's difficult. I should admit that I don't know how you do this amidst all the things that we ask you to do in curriculum-wise. It's a great job, and congratulations on a successful week. I'm the first one to say and hope that the community, this School of Medicine community, will be with me in saying the same thing, that it should not be always upon the marginalized and the vulnerable to advocate for themselves, because we are at the pinnacle of education. If you think about education hierarchically, we are right there at the top, and so it is certainly incumbent upon us to address the needs and the challenges that the vulnerable and the marginalized communities face. While our students have taken a great leap in doing this, I can promise that the administration also will be equally committed to this. And as Sarah mentioned, we did integrate the topic into the P4 discussion, placed it additionally in that curriculum. And we also have more opportunities for open discussion and debrief after tough topics. And on the faculty side, I'm committed to, and I know Dr. Baker, the Vice Dean, and the Dean is committed to making sure all the faculty receive training and on anti-racism related topics and also on microaggressions. And when we move to the quarter-based academic calendar structure, which is next year, we'll have, we already have planned for every quarter having a dedicated time for addressing topics like this. And while I have the microphone and the stage, I also want to draw your attention to the most recent New England Journal of Medicine journal that talked about, how it's not race in medicine, racism in medicine. It talked about, I was really shocked to read how powder cocaine and crack cocaine is treated differently, because crack cocaine is the one that is more found in the marginalized or Black population communities. And so these things are things that we have to call out for what they are, as opposed to understanding and accepting that as something a norm. So again, this is all to say that we are committed to this, and this last week has been a great opportunity for us and a wake-up call in some sense, for me as a newcomer and as an educator, to do my part in doing this. So thank you.
Thank you so much, everyone. And this concludes this week's Med Talks, and we look forward to seeing you next time.